When it comes to dental trauma of the adult teeth, it's a bit more complicated because these adult teeth are meant to last your child their whole life. Adult teeth at the front can appear from around the age of 6 and onwards, and when the tooth is initially erupted, it is not fully formed at the root, and this is where the complications happen. So if a tooth is injured early on, because of that root not being as mature as it would be in an adult, it can have different kinds of damage or make the treatment of that tooth a bit more complicated. The only way to know is by doing thorough assessment, which would be carried out by the dentist here at Sunrise Dental Clinic, either myself or one of my colleagues. We'll take dental x-rays, we'll do different tests on the tooth, and we will note down all of our findings. Usually the first 2 weeks are not predictable in a tooth that has been injured, and we would need to keep monitoring to make sure that any changes were going to last and impact the treatment that your child needs. Sometimes, because the injury is traumatic, we need to actually focus on the non-dental aspects. So making sure that your child receives the care they need for the non-dental aspects of their injury is important. Then we can follow on with checking for dental injuries. Dental injuries can range from the tooth entirely being avulsed or leaving the jaw, which is one type of injury, or it could just be a small chip and anything in between. Sometimes the dental injuries are not visible to us because it's just merely that the tooth has been concussed or moved in the socket where it sits, and in that case we would only know due to the history that you provide about the injury along with the clinical and radiographical findings. So radiographical findings are x-rays, and x-rays are taken as standard when we have any injuries because we want to know what is happening at that point, and we want to have a baseline to refer to so that we know exactly if there's any changes going on. If at any point between appointments your child has any pain or starts to show signs of infection, your dentist would instruct you on what to look out for and how to get in touch to get an appointment sooner. There is an app called Tooth SOS which you can download onto your phone, which has a very nice guide of what to do when faced with a dental trauma emergency. So if your child ever bumps their teeth, you can open up this app and you can be guided by it to seek the right attention and the right help for your child. The simplest treatment your child might require would be monitoring, which means regularly having clinical and radiographical investigations to see what's going on. It could range up to having a root canal treatment for the teeth that are involved, and it could involve some white composite fillings. The main aim when your child has a dental trauma to their adult teeth when they are young is to try and preserve that tooth for as long as possible. This might be forever until they're older, or it might be just until adulthood when a different kind of prosthesis can be provided when they lose the tooth, if they lose the tooth. So the aim of our treatment is to keep your child pain-free, infection-free, and with that tooth retained for as long as possible. And that is what your dentist will explain to you once the injury has been assessed and we have made a plan of what we can do to help initially.